Chapter 4, Video 1. Today we're going to talk about the technical aspects of the EKG. Electrically speaking, the heart is a transmitter and the EKG machine is the receiver. So please remember that. The heart is actually the transmitter. Electrical impulses that are generated by the heart course through the body, and these electrodes pick up these impulses and send them to the lead wires through that cable into the EKG machine, where the amplifier turns up the signal and the digital converter converts the analog signal to digital, which we're going to break that down for you in just a moment. But the heart is the transmitter. These impulses go through these lead wires into the machine, and there's certain factors that you must understand about this moving forward. So, talking about the EKG, you need to know what the electrodes are. The electrodes are the small adhesive patches with conduction gel on the back side of them, or either on the skin side of them that sticks to the skin. And you put these electrodes on the skin, and they pick up the impulses and they send them down through the lead wires. The lead wires are the small wires that are attached to that electrode patch to a cable into the EKG machine. So you have the electrode patch, and then you have the wire that hooks those patches into that machine. That's the lead wire. Remember, the lead wires carry those impulses. The actual lead is the picture of the different views of the heart that we're actually looking at on the EKG. So know the difference between the lead wires and the actual lead. That's very important to understand that. And then the amplifier, that's the instrument that amplifies or magnifies the signal. And then we have the digital converter, and it converts analog signal to digital so it can be recorded onto paper. We have different EKG machines. Some EKG machines are Bluetooth that allow the transmission of the EKG from the nearest hospital. So, like, just say, for instance, an EMS driver is going out to pick up a patient who is suspected of having a heart attack. Well, that ambulance is equipped with Bluetooth and internet. So they're able to put the EKG on the patient, and through internet it will send it to the emergency room that the patient is going to, and the doctor can be studying that strip, and the doctor may even say, I want you to give this patient X amount of this medication while you're en route to the hospital. Or the doctor, that gives them time to know what they're dealing with. If they're dealing with a heart attack victim and they know that patient is having a heart attack, and they're going to take them into the cath lab, while the patient is en route to the hospital, the cath lab and the hospital folks can be preparing for what they're dealing with when the patient gets there. This kind of shows you how a person is attached. This is a man attached to an EKG machine, which that placement is not exactly what we're looking at here, but this just gives you an idea. We have different control features that we need to know when we're speaking about EKG machines. Chart speed. Chart speed regulates the speed of the EKG printout. Guys, you must know this. The normal chart speed is 25 milliliters per second. We can regulate the speed at which the paper records. 25 millimeters means it records 25 little blocks in 1 second. If you change this and you change it to 50, it means that 50 little blocks will be recorded in 1 second. Turning up the speed doubles the width of the complexes. So changing chart speed is very useful in fast rhythms because they can widen them out so we can make them easier to interpret. However, the normal chart speed is 25 millimeters per second. If you change that chart speed to try to get a better idea of what's going on with that rhythm, it's super important that you let the doctor know that you changed that speed, and they know exactly what they're dealing with here, that they're dealing with a fast rhythm or whatever it may be. The gain The gain regulates the amplitude of the EKG wave in the complexes. So basically what this saying is the gain regulates the height. The gain is concerned again with the amplitude of the waves and complexes. So that means it is regulating the height of these complexes. The default gain setting is 10 millimeters per millivolt. So it's 10 little blocks upward. It is critical to check the increase and increase the gain setting if the patient appears to be in a flatline rhythm. So if the gain is too low, they could appear to be in a flatline rhythm. But if that patient is sitting there and they're talking to you and it's showing that flat line, it's a good indicator that the gain is off. So you want to check that gain and make sure that it's right. So always check the gain if you think you're dealing with a patient that may be in flatline. The frequency response filters out any extraneous noise and artifacts. It provides for a smoother EKG. Make sure that if you change any of the EKG settings that is documented on the strip, we want to make sure that we prevent any kind of misinterpretation. MacroShock is a high voltage shock that results from inadequate grounding. This could be a result from frayed or broken wires or cord or electrical outlet damage. So we need to always inspect our equipment. 110 volts of electricity can travel to the patient. This can result in burns, neurologic damage, fatal heart rhythms. So we want to make sure that their skin is dry and intact and that equipment is working properly. So we work to prevent injury. And then MicroShock, it can happen while doing the EKG. It's smaller shock that travels up the conduit into the heart, such as the pacemaker or other device. It's still dangerous and it can be caused by frayed or grounded, improperly grounded wires. So again, properly maintaining the EKG is important. So MacroShock is a lower voltage electrical shock as compared to MicroShock is lower voltage than MacroShock. And so do know the difference between those two. And now we're going to talk about artifact. Artifact is unwanted interference on the EKG tracing. We have 4 different types of artifact that we're going to talk about. The 4 different types of artifact that we're going to talk about are somatic tremors, baseline sway, 60-cycle interference, and broken recording. So with artifact, I'm going to go over these 4 different kinds. You need to always follow the visible QRS waves, check the patient, check the wires, check the patches. If the patient is responsive or whatever, you don't want to immediately go into defibrillation. You need to troubleshoot and check. If that patient's walkie-talkie and they seem to be fine, but you're looking at something that you think that may be a critical rhythm that we're going to get into later, start troubleshooting. The first artifact that we're going to talk about is somatic tremors. Somatic tremors, I'm going to show you on the next slide. This is an example of somatic tremors. Somatic means the body is shaken. Patient can they could be running fever, they could be cold. The patient basically is tremoring here. It's a jittery pattern caused by patient tremors or by shaking the wires. So when we think about somatic tremors, what are we going to do to prevent this? Okay, we need to help the patient relax. If they're cold and they're shivering, we need to cover them up. If the wires are tangled up, we need to untangle them. If the patient has Parkinson's disease and they always shiver, then we need to document that on there. We need to attempt several EKGs and then choose the best one to give to the doctor and let them know this is attempt number 6 out of this is attempt 6 out of 6 attempts, or this is attempt 5 out of 7 attempts. We need to let the doctor know how many times we've tried to get this EKG, but this is the best one we can get. With Parkinson's, it's often very common that we have to take several and get the best one that we can get, and then again we need to let the doctor know that. If the patient is running fever and they're shivering, we may give them Tylenol. So, we got to treat the cause when we're dealing with somatic tremors. But you can pick out the QRS here. So you can look at this and see, okay, we have a QRS, P, well, we're tremoring here, but I'm going back into a QRS here. So you can see those march out. Baseline sway. Baseline sway, the baseline moves up and down. So that isoelectric line here, you can see is kind of traveling up and down. It is caused by a breathing pattern, and you may see this if a patient has a lot of lotion on their skin. So you want to wipe off any lotion, any sweat, and make sure that you're getting these pads stuck down to dry skin. Baseline sway is not a problem as long as waves and complexes are clear. So you could actually turn that strip in to the doc. It's not going to be a problem. Now we're going to talk about 60 cycle interference. I'm going to flip over to this slide. 60 cycle interference is a thick looking pattern on paper, and it's caused by too many electrical devices close by. So we may want to unplug some machines in the room. If we've got several cell phones plugged up, whatever we have plugged up, we want to make sure that those are unplugged. Now, you do not want to unplug any critical equipment. If the patient is on the ventilator, and naturally we don't want to unplug the ventilator, but anything that could be causing the 60 cycle interference. It's a thick looking pattern, and it's caused by electrical devices. And now we're going to talk about broken recording. Broken recording, this is what this looks like. You note that we have the first QRSs here are visible, and then they're all over the place. So we're trying to find that signal. This could be caused by frayed or fractured wires, a loose electrode patch or cable. So we want to first check for that loose electrode patch or that loose cable when we see this broken recording. But do know the differences between your artifacts here.